Good afternoon, and welcome to today's webinar, Strawberries and Cardiometabolic Health, Current and Future Directions for Research. I'm Leslie Samay, Director of Professional Development at Great Valley Publishing Company, publisher of today's Dietitian, and I'm your host for today's webinar. Today's complimentary one-credit continuing education webinar is brought to you with support from the California Strawberry Commission, representing more than 400 strawberry farmers, shippers, and processors, and proudly working together to advance strawberry farming for the future of our land and people. Through science-based information and education, the California Strawberry Commission delivers the good news about sustainable farming practices that benefit the health of people, farms, and communities. Learn more at californiastrawberries.com. And before we get started with today's presentation, I have just 3 short points of housekeeping. First, in order to claim your CPE credit, you know that you have to stay with us for the entire hour-long presentation. Second, at the end of the session, our presenters will be taking questions. If you have a question, type it in your control box on the left-hand side of your control panel, the comments box in the left-hand side of your control panel, and we'll address as many as we have time for. And then finally, just a few disclosures to present. Arpita Basu, PhD, RD, LD, has the following relevant disclosures. She's received grants and research support from California Strawberries, U.S. High Bush Blueberry Council, NIH, the USDA, and the Cranberry Institute, and she's received an honorarium from the California Strawberry Commission and has received grant review panel for the USDA. Burton Freeman, PhD, has the following relevant disclosures. She's received grant support and other financial support from the National Institutes of Health, Common Fund, Nutrition for Precision Health, USDA, California Strawberries, Watermelon Promotion Board, Haas Avocado, National Mango Board, US FDA, and MB Clinical. She's received honoraria from California Strawberries, the McCormick Science Institute, and the Nutrient Institute. And finally, please note that ION Food, the nutrition agency for the California Strawberry Commission, was approved by the CDR for 1 CEU for this webinar. And now I'd like to turn it over and welcome Chris Christian, Senior Vice President of the California Strawberry Commission. Chris leads domestic and international marketing and nutrition research programs. She holds an MS in food science and a BS in microbiology, both from Penn State. She serves on several Produce Trade Association leadership councils and is a member of the Institute of Food Technologists and the Academy of Nutrition and Dietetics. Welcome, Chris, and thanks for being here.
Thank you, Leslie. I'm so glad to be here today. The California Strawberry Commission has been committed to understanding the role of strawberries in cardiometabolic health for the past 2 decades. We're continuing to support clinical research in this area so we can understand how both areas of health impact one another and the effect that strawberries may have on various markers. I'm very excited to welcome 2 of the researchers who have been instrumental in this work. Arpita Basu, PhD, RD, LD, Associate Professor of Kinesiology and Nutrition Sciences at the University of Nevada, Las Vegas. And Burton Freeman, PhD, a professor and chair of the Department of Food Science and Nutrition and director of the Center for Nutrition Research, Institute for Food Safety and Health at the Illinois Institute of Technology. Dr. Basu focuses on understanding the health effects of dietary bioactive compounds, such as those found in tea, berries, and cocoa, in modulating disease, biomarkers in type 2 diabetes, hypertension, and cardiovascular diseases. Dr. Burton Freeman's research interests include dietary strategies to address risk factors of cardiometabolic disease, focusing on whole foods and their unique nutrition bioactive attributes, particularly fruit polyphenols and their metabolic impact in humans. And so with that, I'm pleased now to welcome Dr. Arpita Basu and Dr. Burton Freeman.
Thank you so much, Leslie and Chris, for that wonderful introduction. This is Arpita Basu, and I'm very glad to be here and talk about strawberry research. So certainly we are going to talk about strawberries' phytochemical nutritional composition as the main dietary exposure, and focusing on cardiometabolic health as the outcome for this presentation, and ask the basic question: how does dietary strawberries affect vascular dysfunction in high-risk adults? We're going to be talking about some data from systematic review and meta-analyses, and focus on some selected clinical trials from my research group, followed by summary and practical applications. So strawberries, as we know, is one of the most popular, I would say, berry fruits consumed in the U.S. Not only in terms of household consumption, but a lot of the berry-based dishes in restaurants and other commercial outlets. So, as a result, what we love most, consume most, probably deserves more research for its health benefits, and that's kind of what we're talking about here. So based on the accumulated science, I think strawberries have many different health benefits, as we see here. It's been shown to improve metabolic syndrome, lower risks of diabetes, and based on its nutritional and bioactive or phytochemical composition, strawberries have antioxidant and anti-inflammatory effects, and overall they reduce risks of cardiovascular disease. What you see on this slide, on the right-hand side, are some of the selected nutrient composition of strawberries per 100-gram fresh weight. You can see strawberries are pretty low in calorie. They provide 32 kilocalories per 100-gram fresh weight, and this is quite low when we compare this to something like bananas, probably that has about 90 calories per 100 gram, or even blueberries that's got 57 calories per 100 gram fresh weight. So apart from being low in calories, strawberries provide fiber and a pretty significant amount of potassium, which we know is quite heart healthy, and a very large amount of vitamin C, which is at 59 milligrams. So if one consumes simply 100 grams of fresh strawberries, you get close to 2/3 of your RDA for vitamin C, which I think is pretty impressive. And of course, it's got selected B vitamins. On the left-hand side, we see some of the phytochemicals or bioactive compounds that are specific to strawberries, particularly pelargonidin, anthocyanin, that's been shown to have a lot of its health benefits, quercetin, catechin, some of the phenolic acids, and also the ellagitannins. So what is cardiometabolic health? So when we talk about cardiometabolic health, we are really referring to the normal functioning of the cardiovascular and metabolic systems. And how do we assess these? Typically by the variables that you see listed here. Body weight, adiposity, making sure that the blood glucose and lipids are within the normal values, blood pressure, hormonal control, particularly we're talking about insulin resistance, which follows through the large spectrum of all the way from prediabetes to clinical diagnosis of diabetes, blood coagulation factors, as well as inflammation markers. So poor cardiometabolic health can certainly lead to cardiometabolic diseases and or conditions, and starting with obesity, which may not be a disease itself, but it's a condition that's been shown to be a significant risk factor for diabetes, atherosclerotic cardiovascular disease, hypertension, chronic kidney disease, and heart failure. So again, lots of scientific evidence showing strawberries can impact or improve many aspects of cardiometabolic health, which we will discuss in just a little bit. So this leads us to the metabolic syndrome. So in context of cardiometabolic health, we must define metabolic syndrome. Refresh your memory. What is metabolic syndrome? As you can see, these are the different features indicated by the arrows going outward from this term. So it's indicated by abdominal obesity. Of course, there are cutoff values for each of these, which I'm not going to go into detail, but a quick reminder of these features are really important as we walk through the scientific findings of strawberry research. So it is considered to be a pro-inflammatory state, also characterized by impaired fasting glucose, insulin resistance, elevated blood pressure, atherogenic dyslipidemia, usually high triglycerides and low HDL, and also pro-thrombotic state. So what is the state of cardiometabolic health in the U.S.? Unfortunately, it's not so good. According to CDC data, we all understand 88 million adults, or at least 1 in 3 adults, have prediabetes or features of the metabolic syndrome, including impaired glucose metabolism or insulin resistance. As well as there are health disparities affecting these populations. Particularly, we see high prevalence of metabolic syndrome, or particularly insulin resistance in Hispanics versus non-Hispanic whites. So what is the role of a specific food or fruit? And I get this a question asked quite a few times. And this is mainly because changing the entire diet can be challenging for many of us. But in context of, let's say, a habitual poor diet, particularly from the point of view of low antioxidant and fiber and phytochemical intake, if somebody can add a serving of strawberries with that's packed with many of these beneficial nutrients and bioactives, certainly that can lead to some benefits, as we have seen in our research. So that's what we're going to address, particularly in my research, the role of strawberries in metabolic syndrome. So how does prediabetes or metabolic syndrome become a risk factor for vascular and metabolic dysfunction? So when we think about prediabetes or metabolic syndrome, but the first thing that comes to the mind is above normal blood glucose or hyperglycemia if left untreated. And that itself could be quite damaging to the inner lining of the blood vessels and thereby increasing vascular risks for atherosclerotic and other vascular diseases. Particularly under metabolic syndrome, when we talk about dyslipidemia or atherogenic dyslipidemia, we're talking about high levels of LDL as well as small and medium lipid particles. So particle size also has been shown to be altered in metabolic syndrome. That initiates risks of atherosclerosis. Oxidative stress and inflammation go hand in hand, and pretty much most of the habitual diets are low in antioxidants, thereby increasing oxidative stress, which oxidizes most of these lipids, and these play an important role in initiating endothelial dysfunction and vascular diseases. In metabolic syndrome, we also see high levels of inflammatory markers, particularly adhesion molecules, cytokines, and C-reactive protein. And all of these, via promoting insulin resistance, also cause a lot of injury to the innermost lining of the blood vessels, the endothelial cells, leading to their dysfunction and initiating the process of the early stages of atherosclerosis. And of course, overall diet and lifestyle factors such as high fat and low fiber diets, physical inactivity, smoking are some of the big ones that do affect metabolic syndrome, which in turn significantly increases the risk factor for vascular and metabolic dysfunction. So with that, I would like to talk a little bit about epidemiological evidence, because as we understand, epidemiology looks into the daily habitual dietary intakes and looking at exposures typically at a lower level, particularly for strawberry or the berry intake in general. And then we're going to go into some of the slides on clinical trials where we typically administer much higher doses of strawberries to these individuals. So epidemiological evidence on this slide, we see results from the Nurses' Health Study and the Health Professionals Follow-Up Study. These are very large sample size with 14 years of follow-up. So what we see here is individuals in the highest quintile of anthocyanin intake. Though it's highest quintile, you can see a very smaller, quite a small amount of anthocyanin intake of about 18 to 25 milligrams per day. This is habitual, and this is predominantly from blueberries and strawberries associated with an 8% risk reduction for hypertension. And certainly hypertension is one of the main indicators of cardiometabolic health. And this is significant when compared to the lowest quintile of anthocyanin intake, who had typical very low consumption, as you can see, 5 to 7 milligrams per day. And these remain significant when adjusted for other covariates such as age, BMI, sex, and other dietary factors. So that's some encouraging data from epidemiological studies. And here is another one. This is from the Framingham Heart Study Offspring Cohort. A smaller sample size, it's a cross-sectional study, but it also shows highest quintile of strawberries together with apples, pears, and red wine were associated with a significantly lower inflammatory score compared to the lowest quintile of these food intakes. And again, these were significant in adjusted analyses. So with these data from the epidemiological or habitual dietary intakes. Here is a systematic review of randomized controlled trials. Randomized controlled trials typically, as I said, involve larger amounts of the berry administration to these individuals. And here we're talking about berry-based food interventions and how do they impact cardiovascular and metabolic health. And these are adults with cardiometabolic risks. So I think this is a good summary for today's presentation. And as you can see, the significant cardiometabolic indicators have been indicated on the slide. So there are 5 parameters, including blood pressure, endothelial function, adhesion molecules, blood glucose, and blood lipids that have been shown to be significantly affected by different berry-based interventions. And where do the strawberries come here? So as we can see, the strawberries highlighted in red play a significant role in improving adhesion molecules as markers of endothelial dysfunction. So in these clinical trials, those who consumed 50 grams of freeze-dried strawberries as a beverage for 8 weeks showed a significant decrease in adhesion molecules, or as a result, this indicates improved endothelial function. Secondly, strawberries, again, as administered or consumed as 30 to 50 grams of freeze-dried strawberries for 8 weeks and 12 weeks, or even 6-hour postprandial, that means after meal phase, for 6 hours, showed improvements in blood lipids as outcomes. So overall, strawberries are improving the 2 major markers of cardiometabolic health as revealed by the systematic review of multiple randomized controlled trials. So this is a meta-analysis of randomized controlled trials focusing only on strawberries and cardiovascular disease. So this included 11 RCTs focusing only on strawberries, and all these RCTs used fresh and freeze-dried strawberries as an intervention. Among these, 6 RCTs showed a significant decrease in C-reactive protein as a biomarker of inflammation, and the other 3 showed improvements in total and LDL cholesterol following strawberry intervention. So again, quite significant data in terms of the meta-analyses showing an overall improvement in inflammation and lipid profiles following strawberry intervention. Again, these are adults with cardiometabolic risks. So with this slide, there will be some data that I'll be talking about from our strawberry clinical trial. So this was a study that we published in Journal of Nutrition in 2014. We gave these were adults with obesity and features of the metabolic syndrome, including elevated total and LDL cholesterol, but none of these adults were on lipid-lowering or glucose-lowering medications. We gave them 2 different doses of the strawberry powder that you see in the table. And if you compare them to the epidemiological studies we just discussed, certainly they had much higher levels of polyphenols and anthocyanins, as you can see, as well as vitamin C and overall phytosterol. So they're getting the whole strawberries and thereby the benefits of the whole fruit here. So on the right-hand side, you see the most significant results for this study were improvements in serum total cholesterol in the upper panel and serum LDL cholesterol in the lower panel, which was significantly lowered in the group that consumed 50 grams per day of freeze-dried strawberries for 12 weeks compared to the lower dose as well as their respective control groups. So we also conducted a few other similar studies in adults with elevated lipid profiles and found strawberries improved lipid particle size, and this could be a little different and may not, and some of us practitioners may not be aware of this, but usually when we think about lipids, we think about the conventional lipid profiles such as total LDL cholesterol, triglycerides, and HDL. But another way of classifying lipids is also based on their particle size as small, medium, and large particles, and this has been extensively used in lipid and diabetes research. So what you see on the right-hand side are the effects of the strawberries, where the lipoprotein particles, particularly the LSP, which stands for small density LDL particles, was significantly decreased following the 12 weeks of strawberry intervention at 50 grams per day in these adults. The lower panel also shows some of the adhesion molecules which were decreased or improved following strawberry intervention compared to the control groups. So overall, again, strawberries decreased many of the markers of cardiometabolic, poor cardiometabolic health or risks of atherosclerosis in these clinical trials. This is another study where we looked at the effects of strawberry supplementation again, 50 grams of freeze-dried strawberries. This was a randomized crossover 26-week study, and these were adults with the metabolic syndrome and knee osteoarthritis. So they had pretty much, you can think of, a higher burden of inflammation compared to healthy adults as well as those only with the metabolic syndrome. And that's one of the reasons we wanted to see, does strawberries improve markers of inflammation as well as pain symptoms. So if you're looking into this article, which we published in Nutrients in 2017, it certainly talks more about the pain scores that went down with the following the strawberry intervention for 12 weeks. But we also reported some of the significant improvements in the markers of inflammation. So in this study, we saw significant improvements in IL-6, IL-1 beta, which are the inflammatory interleukins, as well as TNF-alpha in the strawberry intervention group compared to the control phase, as well as the baseline. And remember, this is a crossover trial, and we love crossover trials because it really takes out the inter-individual differences when different adults are recruited in the intervention and control arms separately. So again, these were pretty significant and exciting data for us. And these are data from our more recently completed trial, which we published last year. And in this particular study, we recruited adults with metabolic syndrome and specifically insulin resistance. And in this study, based on the previous significant findings, we actually wanted to test a lower dose of strawberry intervention. So here we gave them what you see as LD is the lower dose of only 1 serving per day for 4 weeks, and the HD is 2.5 servings per day for 4 weeks. And of course, both these interventions were within the recommended levels for fruits and vegetables by the USDA dietary guidelines. So overall, in these adults, again, these adults were not on lipid-lowering or glucose-lowering medications. What we saw is some interesting findings on the role of strawberries in improving insulin and insulin resistance in these adults. And here are some more data from the same trial that we also reported last year. We did not find much of a difference in inflammatory markers, but we were again interested in antioxidant markers in this study. And what you see on the upper panel on the right-hand side is the serum antioxidant capacity were increased with both the one serving as well as the 2.5 servings of strawberries for 4 weeks each. And on the left-hand side, we also saw increase in serum SOD, which is superoxide dismutase. It's an antioxidant enzyme activity here, which was again significantly increased following the low dose and the high dose strawberry intervention compared to control and baseline phases. The lower panel shows the levels of serum MDA, which is a marker of oxidized lipids. As we discussed, oxidized lipids are higher in prediabetes or metabolic syndrome, and they play a very important role in atherosclerosis. So again, those were also decreased in both the low dose and the high dose strawberry interventions corresponding to 1 and 2.5 servings of strawberries per day for 4 weeks. So quite interestingly, I think though this was a short 4-week intervention, we saw some significant improvements with both strawberry doses in adults with obesity and features of the metabolic syndrome. So that brings me to the end of my presentation, and here are some practical applications. So strawberries overall exert significant anti-diabetic effects, and in our studies, we have shown it improves insulin resistance and blood lipid peroxides. They also exert anti-inflammatory effects by decreasing blood cytokines that have been associated with diabetes-related atherosclerosis as well as insulin resistance. And also strawberries have been shown to be beneficial in reducing lipids and small LDL particles that lead to vascular complications, both in metabolic syndrome and diabetes. So I think based on the evidence that we have seen in our studies and others, as a nutritionist, I would strongly recommend adding fresh, whole, as well as frozen strawberries to the whole to the habitual diet, and these changes, hopefully, these benefits can be translated to the general population without changing the entire diet. So, thank you very much.
Okay. Well, thank you very much, Dr. Basu. My name is Burton Freeman, and I'm very pleased to be here with today's dietitian and the many people in the audience to talk about strawberries and cardiometabolic health. Dr. Basu did a phenomenal job in opening up our session and really laying the foundation for which I will take a little bit deeper dive into the unique attributes of strawberries, looking at their chemistry, asking questions if they're absorbed, some of these bioactive phytochemical compounds. Certainly they can't do their job unless they are absorbed. And does eating more strawberries matter? So do we get more of these unique compounds in the body? I'll then transition to talking a little bit more about functional benefits. Dr. Basu has already mentioned many of those benefits being on blood pressure regulation, metabolic effects, and insulin sensitivity. And I'm going to show you more data that suggests that strawberries certainly have a role in vascular health and metabolic control. And then finally, I'll just wrap up with a few practical implications and future directions for research. So in this first slide, I really look at it as a summary of the type of research that we do in my lab, and that is to understand the chemistry of the foods that people are consuming. We look through in mass spec whether they are showing up in the blood, so when do they appear, and then we follow that with some graphs so that we can look to see when they peak and when they finally clear. And then all of that we can associate with health endpoints. I don't think it's lost on anybody in this audience about the health-promoting constituents in strawberries, but just as a reminder, they contain a number of vitamins and minerals and fiber. But maybe what you know less about are some of these phytochemical compounds. So starting on the left, some of the phenolic acids, they're certainly contained in strawberries, but probably what they're best known for are their anthocyanins. And the anthocyanins are those pigment compounds that give strawberries their rich red color. Among the anthocyanins that are unique to strawberries is a compound called pelargonidin glucoside. And strawberries are, if not the richest source, among the top richest sources in our diet of pelargonidin. We also see flavin-threols. These are some of those compounds that we associate with the health benefits of cocoa. Strawberries contain these compounds as well. And then they also uniquely contain hydrolyzable tannins, and specifically the elagitannins. So collectively, strawberries have this unique signature of compounds that complement their essential nutrient components. So one of our early questions was, asking questions relative to bioavailability. Are the components in strawberries absorbed? And if they are, what is their kinetic profile? Again, when do they peak? When do they clear? Because then we can start associating health benefits with those peaks and clearances. And so we can look at blood, we can look at urine, but blood gives us a really wonderful snapshot for, when are these compounds going to peak and what are the metabolites that our cells are seeing. And so what we've determined, and I'll just show you a nice graph here, is that pelargonidin, the signature anthocyanin in strawberries, peaks in our blood in about 1 to 3 hours, depending on what else it's consumed with. And that's shown here with just 1 cup of fresh weight strawberry compared to a control. And this was given as a beverage. But as I mentioned, strawberries also contain a variety of other compounds. And one set of compounds, these tannins, the elagitannins specifically, are very large molecules. They break down to ellagic acid, and then with the help of our gut microbiota, they form these urolithins. The gut microbiota also helps us metabolize other components that make it to the large bowel, so they're not readily absorbed. Some of the anthocyanins will not be readily absorbed, and they'll make it to the gut microbiota. And that's where we'll see these phenolic acid metabolites. Because we are engaging the gut microbiota, we're going to see increases in our blood at much later time points. And so this was a study that we did to look at ellagitannin metabolites, and specifically urolithin A glucuronide. So that's just a metabolite that's made. And you'll see that the highest concentrations occur not right after we eat strawberries, but many hours later, and peak probably at about 24 hours. Now, these may continue to go up. We haven't extended our studies to look further, but you can see there is a decent rise at 24 hours. So that's thinking, if I've had strawberries yesterday, they're peaking, some of those compounds from our microbiota are peaking the next day, which if it's yesterday, today. In addition to asking questions relative to just absorption, but what if we eat more strawberries? Do we have a dose-response relationship? Or is just a single amount, no matter what it is that just that there's going to be a threshold relative to these anthocyanins that get in our blood? And the answer to that is that there's a dose-response relationship. The more strawberries we consume, the more of these anthocyanin metabolites that get into our blood. Now, I'm showing you here a range of intake of strawberry, and on the right-hand side, you can see it says 10 grams, 20 grams, 40 grams, and some of you may be thinking, what does that mean? Well, this is a freeze-dried strawberry powder, so think about a dehydrated powder, right? So no moisture, and when we use this powder, a 10-gram amount is the equivalent of just under 1 cup, okay? 20 grams is just under 2 cups, and 40 grams would be a little bit more than 3 cups, okay, if we were looking at that fresh weight. When we utilize these powders, that allows us to do controlled studies like Dr. Basu described, these randomized controlled double-blinded studies. And that's one of the values of having the powders. And if they're freeze-dried, they represent the nutrient and phytochemical composition of fresh. We also want to ask questions not only acutely if we ate strawberries, but what if we ate strawberries over 90 days in this case? And this is a research project that we collaborated with colleagues at the USDA in Boston at Tufts University. And essentially what we found when we followed those elagitannin metabolites, so these are those urolithins, we found that compared to the first day, over 45 days, we saw increases of these metabolites in their blood, and even more so 90 days later. So if we kind of look at, what is the story so far, strawberry signature compounds, these anthocyanin elagitannins, are absorbed and they're metabolized by the human body with some help from our gut microbiota, and they increase in the blood with the amount of strawberry consumed and with regular consumption. So moving on to those functional benefits, what are some of the health benefits? I'm going to focus on insulin resistance and sensitivity and endothelial function and vascular flexibility. And these are some of those same cardiometabolic risk factors that Dr. Basu described in her presentation. Insulin sensitivity is a big one because many of the risk factors for cardiovascular disease are precipitated by insulin resistance. Insulin resistance is usually the outcome of poor insulin signaling in our peripheral tissues. So if we think about insulin being that key that opens up the door to let glucose into our muscle cells, for example. If that key is not working very well, we'll have high levels of glucose running around in our blood. So you can see just from here that insulin resistance is a risk factor for high blood pressure, obesity, hyperinsulinemia, diabetes, endothelial dysfunction, small LDLs. Dr. Basu talked about this, dyslipidemia, and hypercoagulability. The association with diabetes, insulin resistance, yes, as a risk factor for diabetes itself, but diabetes in and of itself is a risk factor for cardiovascular disease. So when we think about cardiometabolic disease, we're really addressing many of these factors, not just one factor. So making the connection between these metabolites that I described and fuel metabolism, remember I mentioned that the pelargonidin or these anthocyanins peak very early after we consume them, so within the first couple hours. Well, if you think about how our body metabolizes meals that we consume and those increases in insulin, it too also increases rapidly to take care of that glucose that's been absorbed from the meal. And so here we're asking whether these anthocyanins are working at the various tissues to let glucose in. Now, some of you may or may not be familiar with insulin resistance or maybe what it looks like. You may know that it's characterized by hyperinsulinemia, meaning you have a lot of insulin trying to take care of that glucose load, but maybe you haven't seen what that looks like after consuming a meal. So I slipped in a slide just so that you can see that glucose can look very normal, as shown on the left-hand side, whereas the insulin concentrations in a person's blood can be markedly different. And this is actually an example of a group of individuals, some who are very insulin resistant, so they have this high insulin resistance, which is the blue, those that have low insulin resistance. And if I were to look at an individual that had normal insulin sensitivity, their insulin would be even half of what you see in red. So it just continues to increase in the sense of how much insulin is being required to take care of the glucose load. Well, you can imagine that demand then has an impact on the pancreas as a burden. And consistently being hit with that burden is what wears out our beta cells, which then causes failure and transition to type 2 diabetes. So the goal here is to really understand what are those factors that increase or reduce insulin signaling, so induce this poor insulin signaling and poor glucose uptake. And what we see from this cartoon, but it's actually a depiction of some cellular studies that we did in our lab with my colleague, Dr. Indika Edisering, and these were in muscle cells, that when we had inflammation, oxidative stress, or concentrations of fatty acids and glucose in the cell medium that was very similar to what one would see in a person with prediabetes or diabetes, we had very low insulin signaling as it crossed the cell and poor glucose uptake. When we bathe these cells with a strawberry extract, and this was a water extract so we could pull those phytochemical components out, we saw a change in the pathway of insulin, well, in this case, phosphorylation. So it's this cascade, it's this change within the cells that enhances signaling and increases glucose uptake. And so you're probably sitting there thinking to yourself, well, that's great, those are cells, but what about humans? Well, we asked the same question. So while we have a mechanism of action, we know that strawberries, at least in cell culture, can do this job. Can we translate that to humans? And that was one of the first studies that we did, was to ask the question whether a person or several persons in this case, if they were to eat a high-carb, high-fat breakfast meal with and without a beverage that contained strawberry, so a controlled beverage versus a strawberry beverage, and this had the equivalent of about a cup of fruit, what would be their insulin and glucose response? We also measured inflammatory response. We measured lipid response. I'm just going to show you the insulin and glucose, but I can tell you across the board, we found in this acute paradigm that this 1 cup of fresh fruit had a marked improvement on how much insulin was required to take care of the glucose load. It also reduced inflammation that was induced by the meal, as well as had a lipid-reducing effect as well. But just concentrating on the insulin, it reduced the amount of insulin needed by about 12% to take care of the glucose that was coming in with the meal. We took these results and we asked questions relative to people who already had insulin resistance. Could this make a difference with people who had insulin resistance? And so we recruited a number of people that did have insulin resistance. So this goes back to that slide that I showed you with people that had different levels of insulin resistance. And we followed the exact same meal challenge study design as we did previously, because we just, from a proof of concept, wanted to know, would strawberries have an impact? From there, we can set out to do those longer term studies, such as Dr. Basu did, the 4-week studies, the 8-week studies. And in fact, in this study, this is the dose response. We gave people anywhere from the 10 grams to the 40 grams. So this is just less than a cup of fresh strawberries, for those of you that are marking this down, up to a little over 3 cups, and consumed with this bagel and fruit meal, the fruit being their little balls of cantaloupe. Now, some of you may also be saying, okay, now wait a minute. They're giving a heck of a lot of strawberry. What about that fiber? That fiber can have an impact as well. Well, those of you that have picked that up, you are absolutely correct, and so we controlled for that. We wanted to know what were the anthocyanins and the elagitonin components, the phytochemical composition of strawberries going to do in this acute setting. So we controlled across the board the fiber. So this is not a fiber effect. This is an effect of these phytochemicals. And so what you can see in this next slide is that less insulin was in fact needed when these individuals consumed their meal with the strawberry drink. And that's shown with this red line here. And then I showed you just from a kind of a bar standpoint, the significant effect. And it looks like, from these data that we actually really did need more strawberries to have an effect on insulin. These individuals had a BMI of about 40, so average 40, and they were an average age of 40 years old. We did some statistics to better understand the relationship with the pelargonidin metabolites, and there was a significant inverse relationship. So indeed, these components in strawberries are making a difference relative to the effects on, in this case, insulin sensitivity. We also found that plasma glucose was reduced. So this was really exciting because this was one of the first times that we showed both a decrease in insulin demand as well as a reduction in plasma glucose, further suggesting an effect on insulin sensitivity. And here's some of the statistics for that. And if you're interested in the full article, this was published in 2016 in Molecular Nutrition and Food Research. And then finally, the prior studies were not done in people with type 2 diabetes, but the results also are true for people that have type 2 diabetes. So if they've transitioned, strawberries still make a difference in helping them improve glucose control, reduce lipid oxidation, and decrease inflammation. And that's shown in the upper panel here, but also if we want to dig down into those anthocyanin components, there are some data that suggest that anthocyanin supplementation at the level that we were giving in our acute studies does in fact have an impact across the board for many of those risk factors for cardiometabolic disease. All right, so the story so far, I have just a few more slides to share with you, but indeed we're seeing this decrease in insulin resistance, improvements in glycemia, and increases in diabetes management. I mentioned to you that I wanted to talk a little bit about vessel health, and insulin resistance or insulin sensitivity, certainly a direct connection to vessel health and vascular health. In our lab, we use flow-mediated dilation. This is an ultrasound technique to look at how flexible our arteries are. And we use the brachial artery as shown here to assess that. And there's quite a bit of data to show the relationship between flow-mediated dilation and vascular health. In fact, about a 1% increase in diameter is equal to about a 10% decrease in CVD risk. Vascular health, as measured by flow media dilation, is intimately connected to blood pressure regulation and the overall health of the endothelium. Dr. Pursue showed us that one of the things that these berries can do is improve blood pressure. And so one of the things that we did in this study that was published last year is look more closely at endothelial function. It's actually one of the first steps in the process of atherosclerotic cardiovascular disease. And we asked the question relative to consuming strawberries acutely, so after we've had a drink of strawberry, what happens in an hour, and what happens after 4 weeks of continual daily consumption. And what I'll show you here, and just kind of walking you through this, is the effect on endothelial function. Now remember, increasing vascular relaxation tone means we have an increase in percent FMD. And when we started out these individuals at week 0, those that were in the strawberry arm and the control arm, they had a percent FMD, which is about 3, which is not particularly great. We want this to be much higher for health. And we found that when we fed strawberries, an hour later, we got this wonderful relaxation with the strawberry consumption that we did not see when we gave people a controlled drink. 4 weeks later, we did the exact same experiment, and you can see not much movement on the right-hand side of this slide with the controlled drink, but we did see increases in relaxation and tone with the strawberry drink consumed for 4 weeks every day. This also translated to improvements in systolic blood pressure. These were acute effects, so within a couple hours after consuming, we saw a reduction in systolic blood pressure, but not so much for diastolic blood pressure. So overall, we can see we have both metabolic health effects of strawberries when they're consumed, as well as the cardiovascular health effects, increasing vascular relaxation, tone. And while I didn't show you too much about inflammation and oxidative stress, we had those effects as well. So just real quick, to wrap up, some practical implications. One of the things that I think is really great about strawberries is that there's room to consume more. We know that some people eat strawberries, but not enough people. And those that do eat them, they're eating smaller amounts and not very frequently. And so including strawberries in the diet regularly, having the evidence that supports including them in the diet regularly does a couple different things. One, it increases the amount of total fruit consumed. We know that people are consuming about half of their required fruit intake in a day. So this helps meet that goal of increasing total amount of fruit consumed. We also see strawberries as increasing the diversity of nutrients and phytochemical bioactives in the diet because they're not being consumed enough. And together, this increases our ability to address the fruit gap. So what is the fruit gap? Many of you might be thinking, well, I've heard of the fiber gap, but I haven't really heard of the fruit gap. Well, the fruit gap is global. The Global Burden of Disease study, which many of you may be familiar with, tells us that a diet low in fruit is among the top 3 dietary risk factors for cardiovascular disease and diabetes. The top 3 being low fruit intake, low whole grains, and high sodium intake. So fruit, too little of fruits right up there. We also know that from the data that's out there that increasing fruit variety lowers risk for developing diabetes. And so together, when we think about the evidence to develop policy, set recommendations for what people should be consuming and how much they should be consuming, all of this fits right in to that to that path for helping people optimize their health through dietary strategies. And from a dietary strategy standpoint, as little as 1 cup per day of strawberries shows beneficial effects. And so thinking about future directions of research, are we done here? I would say absolutely not. And in fact, there's quite a bit of work being conducted now, significant investment into this idea of precision nutrition for health and individualizing recommendations. Many of you may look at the literature and say, well, sometimes you get a big effect, and using strawberries as an example, in people, and sometimes the effect is modest, or maybe we don't see an effect. Well, this all relates to human variability. And why some people respond differently than others is really that future research, precision nutrition for health, and how can we determine exactly how many strawberries or how much from a cup standpoint should people be consuming? Because we know that some people do really well on a cup, whereas others may need far more. And so being able to individualize those recommendations I see as really a tool for all of us. And for those of you in the audience, being able to say, this is what you need to address your situation and to meet your health goals. So I think that's where future is going. As I mentioned, there's a lot of work already started, and I look forward to doing even more with strawberries in this way. So with that, let me just close by acknowledging a team that I work with on a daily basis that's just phenomenal. Much of that work would not be possible without this group that I've shared with you today. And with that, I'll say thank you, and I think we'll have quite a bit of time for questions. So I look forward to it.
Many thanks, Britt, and many thanks, Arpita. That was excellent content, and we do have a number of questions here, and so I'm just going to read one off. Just bear with me a moment as I'm working through my technical difficulties on my device. But here was an interesting one. Are there any foods that enhance the absorption of the active compounds in strawberries?
Okay,
Britt, would you like to take that one?
Yeah, I can take that. You know, we haven't really done a ton of work to look at enhancing. We do know that sometimes consuming milk products with strawberries, I showed you the shake that we made, can reduce the absorption of some of those components, but we don't see a difference in their effects on the health outcomes. One of the things that we think is that it may reduce that immediate absorption, but just allowing these components to get to the lower parts of the bowel. There are some interesting ideas, you know, using like herbs and spices as a mechanism to increase some of these components, but we just haven't done that work yet. But great question.
Yeah, thank you. And then we had another one. This one might be good for Arpita. How do fresh strawberries affect metabolic syndrome versus freeze-dried strawberries?
Great question. Yes. So fresh, definitely a lot of the observational studies or epidemiological evidence are based on fresh strawberries, and certainly in clinical trials, it's really difficult, as you can imagine, to use a lot of fresh strawberries. But again, Dr. Burton Freeman studies have used those for acute or postprandial studies. But I would say fresh and frozen are quite identical in many ways, except that they might taste a little bit different. The frozen ones have to be thawed. But again, most of the trials that we have reported, we have used freeze-dried strawberries, which are quite similar to frozen strawberries. Of course, they have been ground up as a coarse powder that's quite that could be easily consumed, reconstituted in water as a beverage. So I would say at this point of time, there's not much of a difference between how fresh versus frozen would affect features of the metabolic syndrome. So if one consumes either of the two in at least as much as I would say, at least adding one serving per day to the diet, at least a cup of whole strawberries, that's about 8 whole strawberries, I believe. I think everybody would get to see some of these benefits, even as since we observed some data, which I showed in the last slide. Those are looking at 1 serving of strawberries per day, increasing total antioxidant capacity, as well as decreasing oxidative stress. So even at lower amounts, we are seeing these benefits of freeze-dried strawberries, which are equivalent to frozen strawberries. So I would say not much of a difference between fresh versus frozen, and I would recommend either for the metabolic syndrome.
Great, thank you, Arpita. There was another question regarding, I believe it was regarding fiber content, and I'm trying to find it here. What happens if you do not control for fiber? Does fiber have any effect on anthocyanin absorption?
I'll take that. This is Britt. Thank you for that question. So we don't really know if we took fiber completely out of the equation, whether we would get more anthocyanin absorption. What I really like about the study that we did with fiber is the fact that we could probably show even more robust strawberry effects if we did not control for fiber. In other words, we had a pretty active control in that study. And so if you can imagine, if we didn't have that fiber in the control, the separation between the effect of strawberries would have been far greater. And indeed, we do eat strawberries as a whole fruit, which contains, the essential nutrients, the fiber, and the phytochemical components. So it's an amazing package of goodness. Great question. Can't say if the fiber interferes or not directly.
Yep, great. Thank you, Britt. And I see we have maybe a couple minutes left, and we do have a number of questions regarding pesticide residues in the dirty dozen. And I would like to answer and just explain that, both conventionally grown and organically grown strawberries are safe to eat. And this is clearly demonstrated on an annual basis by the reports of USDA's testing of all foods, and especially fruits and vegetables that are highly consumed by both adults and children. In the most recent USDA pesticide data report, 99% of the fruit samples that had any residue detections, those residues were well below government tolerances. Tolerances for pesticides, pesticide residues in foods are set by the EPA. They are 100-fold lower than any known risk level for those particular compounds, and those levels are set with consideration for infants and children consuming food as well. And there is significant science and research published demonstrating that the greatest risk to consumer health is not eating enough fruits and vegetables. So we always recommend that people eat more fruits and vegetables. If you choose organic, that is great, but you don't need to spend the extra money for organic. Conventionally grown fruits, and particularly strawberries, are equally safe to eat. So I hope that answers that question. And let's see, one more. I think we have time for one more, or Leslie, do we need to wrap it up? We have 3 minutes left according to my clock. So
yeah,
one more for our scientists.
Go for it.
Okay. There is one. Would you recommend that your client eat strawberries on a daily basis long term, and how do strawberries compare with blueberries or raspberries?
Well, I'll start, and I think Dr. Pursue might follow up. Many of our studies are conducted with daily consumption. There's no reason for me to believe that eating them less frequently, so every other day, wouldn't also have beneficial effects. And this is one of the values of understanding the kinetic profile of these metabolites. When do they peak and clear? And so, one of the things that strawberries do is they provide us a number of components that are constantly circulating in our body to have benefit. So I guess that's that. From a chemistry standpoint, raspberries and strawberries have their unique composition. They do share some of their compounds, but in different ratios. And blueberries, just by the color of them, you might imagine, contain a different composition of anthocyanins. They too have anthocyanins, but they are different anthocyanins than what strawberries have. And blueberries do not have the elagitannins. They have more of the condensed tannin type compounds.
Absolutely. I fully agree with what Dr. Burton Freeman just mentioned. I would strongly recommend consuming strawberries on a daily basis, and that's what we have done in our clinical trials, all the way ranging from 4 weeks to 12 weeks, as well as for 24 weeks in a crossover design. So certainly getting those, we don't store a lot of these anthocyanins or polyphenols. We are excreting them constantly. So getting those in on a regular basis is certainly the need, I would say, for this time and age, given the public health scenario of poor diets with low antioxidant intakes, as well as the obesity and diabetes epidemic. As far as the comparison goes, I think there are few berry studies, to my knowledge, particularly in clinical trials, that have shown improvements in insulin resistance, which I think is very important. And I think both Dr. Burton Freeman and I stressed that in our presentations, because we really need to address insulin resistance, which starts off much earlier before we get to the point of full-blown clinical diagnosis of diabetes. And at that time, it's hard to reverse the process. So I think strawberries are showing very significant data in having less insulin being used. And I think till date, there are about a few significant studies compared to raspberries. I'm not sure about there are any studies showing improvements, similar improvements. There are probably 1 or 2 studies with blueberries, but again, they required a higher amount of blueberries to show some improvements in insulin resistance. So overall, definitely, it's much better to add a serving of berries, particularly strawberries, to your diet. And just keep in mind the calories, as I stress. We also need to worry about the total calories. I think they're probably the lowest in strawberries when compared to other fruits.
Thank you both very much. I think I need to turn it back over to Leslie for some final comments.
All right. Well, wonderful. Thank you so much, Chris, and thank you to both Dr. Basu and Dr. Burton Freeman for being here. I echo your sentiments on the webinar. It was a great show. Thanks, everyone, for joining us, and thanks, Chris, as well, and the California Strawberry Commission for supporting the Today's Dietitian audience on this kind of quality programming that we just experienced. And so what's next? We always talk about this as a part of our ending of each of our webinars. On Wednesday, November 30th, so we've got a couple weeks off for the Thanksgiving holiday, from 2 to 3 p.m., join Vicki Rotellny for a complimentary webinar, another freebie from us, Therapeutic Lifestyle Changes for Prediabetes and Type 2 Diabetes. Vicki is going to take an evidence-based look at the therapeutic lifestyle changes that help prevent and treat prediabetes and Type 2. And this webinar is brought to you free of charge thanks to Fresh Avocados. Love one today. Register at ce.todaysdietitian.com/lifestyle changes diabetes. And everyone, your attendance certificates are now ready to download. Follow the instructions on the screen or refer to the final slide of the presentation handout for more information on how to complete the evaluation and access your certificate. And so with that, we've come to the end of the hour and then some. I hope you all enjoyed our webinar today, and I hope you have a great rest of your day and a great rest of your week. Thanks for joining us.